Me in my living room. Okay. So today I've had some questions about bladder health. Hi, this is Jessica. I run the CPMS group, the Canadian Perimenopause Menopause Support Group. I'm a private coach. I'm a certified yoga therapist and insured as a health and fitness practitioner. So I just thought I would give you the brief overall. Yeah, bladder issues is a menopause issue for a lot of us, um, because the dryness of the area can just contribute to the urethra as a tiny little hole where the pee comes out, and it's dry, which means any bacteria, naturally there's bacteria around. It doesn't mean that you're dirty. It doesn't mean that you didn't clean yourself properly. But because the urethra is dry, it can climb up into the bladder and cause a UTI or just inflammation, just general dryness is uncomfortable. That dryness can also mean that the elasticity of the skin itself in that area is now dry and brittle and not as responsive. And then when you try and stop the flow of the urine, you might not be able to. Another thing that commonly happens is our muscles are actually tired from tensing too much. Our internal muscles are too tight, not too loose. So then we do Kegels a little bit improperly on top of that and actually make it a lot worse. So here's one of the books that you could potentially want to check out, Jen Gunther. I actually don't really love this one, um, but it is good as far as information about the medical side of things. So if you're like, oh, I want to know if ashwagandha might be a possible help for me, don't bother looking in this book. She just tells you to take drugs. And I'm not against drugs. I use drugs all the time, use them properly, use them as they're prescribed. So here's what she has to say about estrogen therapy and bladder health, okay? Because estrogen therapy is the one that we're having trouble getting just in general, even though the estrogen cream does stay where it is applied, right? It doesn't go systemic. It's not going to make your overall estrogen increase. And I know that because I had too much estrogen systemically and not enough in the area. So I was getting recurrent urinary tract infections. And on page 180 of this book, she has a whole section about urinary tract infections. And one of the other things I wanted to mention is that you can have a UTI and not have symptoms. Okay, like we're used to this, painful, frequent urination, a lot of difficulty. It becomes very obvious that that's what's going on. But you could have no symptoms and be having a UTI that would still make it difficult to hold the urine. Um, it's just another stress on the body in general and can even cause more brain fog. So, vaginal estrogen, here's what she says. The data suggests the cream may be better. I actually like the cream better, honestly. Although there's a new product, I am Vexi, I think it is, and that has estrogen and it's apparently really nice. But try whatever product or DHEA appeals to you, right? Because there's different options. Um, but if you're using estrogen cream and there isn't a reduction in UTIs, now for me, I went from having one after the other to having none, knock on wood. And give it 6 to 12 months, but you may be needing to switch, right? Like if you tried, Vagifem is also very popular, but it takes a while to melt. So, like, seriously, she has an entire chapter. Chapter 11 is on bladder health. So, if bladder health and problems in that area weren't a part of menopause, it wouldn't be in this book. So, it is absolutely a part of it. And she does mention some of the things like D-mannose, which I have in one of the supplements that I like to use, and cranberry. And she has the basic stuff. So stress incontinence is what we have a lot of, where we are actually too tight and having trouble. So she says some women leak only when jumping on a trampoline or during weightlifting. The activities put so much force on the bladder, the urethra doesn't have a chance. Women who have this situation may be helped by any of the therapies for SUI. So that's your bladder incontinence and urinary tract. That's her acronym, SUI. So you definitely want to be evaluated, right? And this is why a pelvic floor physiotherapist is the lecture that I'm recommending everybody check out. It's on the Queens of Perimenopause. It's available at the gold level. The benefit of going gold is you can look at everything. And there's over 34, or I think it's 36 different videos now up there, including handouts and medical study, although I'm going to do more of those. Um, so it's definitely worth your time. Like most of the videos are an hour, like if they're a lecture that I did or that I interviewed someone else for. So, that's 30 hours of material for, you think about $40 a month. It's going to take you a while to get through all of that stuff anyway. So let's just see. This is the other book that I really love as far as medical stuff goes. It's not Hysteria. This is really brand new. Karen Tang, she has Instagram and she's really funny. So let's just see what she has to say about urinary tract issues. Pelvic exam, pelvic floor dysfunction. So that's what bladder leaks are usually under, is pelvic floor dysfunction. A lot of the terminology is really quite violent. Oh, look, and she has an entire chapter on urinary incontinence, you guys. Urinary issues is a part of female health and it's a part of menopause. So she says, urge urinary incontinence occurs when a person feels a sudden urge followed by a leak. Okay, that's a pretty good idea. Or it could be called overactive bladder. Doctor will ask about symptoms, how often leaking occurs, what triggers the leakage. So this is really important. Basically, don't just think it's part of menopause, so I don't have to talk to my doctor about it. I personally think that the pelvic health physio helped me more than anything else. But if I hadn't talked to my doctor about it, my prescribing doctor, I wouldn't have gotten the estrogen cream. Constipation and smoking can also contribute to urinary incontinence. That's too bad. So there are some different things you can do. Pelvic floor physiotherapy, she mentions, bladder training, which is just this idea that, we're making it worse because we go all the time. And then there are medications that you can use. She even says the vaginal suppositories. And then there's another botulinum toxin that can be injected into the bladder. And she talks about vaginal estrogen too. Very little, if any, estrogen is absorbed into the body through the vaginal walls. It's generally very safe and well tolerated. Generally very safe and well tolerated. That is on page 129. So you could even use that book as a resource. She is a medical doctor. Okay, so I'm going to post this on into the group and make it available for people to check out in the Q&A. Into the Queens of Perimenopause. And I hope that everyone has a beautiful day.